Right, so we have Ellie here who's going to do a health check. Ellie's doing a health check as a first-time user, so the first thing she has to do is give her consent for SISU to manage her data for her. Ellie owns her own data, but we'll look after the data. If she wants to access her results afterwards, she can do that. So she's just given her consent, and now she's putting in her email address. As Ellie's used a health station before, she's putting in her password and it'll recognise her details, and it means that she can access her results in her app. She can look at trends and graphs and understand how her health metrics are tracking over time. So there's a few initial demographic questions. She'll be asked questions such as her age, date of birth, ethnicity and postcode to understand a few different things around her demographics. And then the first part of the health check is the height and weight. So there's a height sensor at the top of the health station, and Ellie's standing on a set of scales, which will give her height and weight, and then that calculates the BMI score. And the demographic details that Ellie gave earlier also have an impact, particularly from the ethnicity perspective, in terms of how BMI is calculated. So Ellie's also now been asked a few more questions around her smoking and whether she vapes, and that goes into some of the questions around doing blood pressure. So she's been asked whether she's done a blood pressure check in the last 12 months. She's just putting her arm into the cuff as now. So you'll notice that Ellie's put her arm in, she's in a seated position, and she's turned her palm up. So all of these instructions are on the health station to make sure that the health check is consistent and as accurate as possible. Interestingly, we know from our data that around 70% of people who do a health check on a health station for the first time haven't had a blood pressure check for at least 12 months. So what's really important is we're getting people to do health checks in opportunistic circumstances, and we do also know that around 20% of people will be identified potentially with blood pressure risk, which may need to be addressed by going to see a GP or going to see their pharmacist and following up to see if there's any action that needs to be taken.
So this next trip out from the machine to storage.
So Ellie's got her blood pressure results, and she has a recommendation that's personal to her based on her result. And depending on the level of risk, there'll be a different type of recommendation. And in this particular circumstance, we're in a boot store, and this has been commissioned by the NHS. So we are actually connected with a local service called Thriving Nottingham. So if Ellie had high blood pressure, she would have been offered the opportunity to share her results with the organisation, and they will either call her, email, talk to her about results and see whether she needs to be progressed onto an appointment to investigate further. Next part of the health check that Ellie's moving on to now is doing a body fat check. So she's put her two hands on two metal handles. It's sending an electrical impedance signal around her body, which is measuring body fat. And that's a really, really important part of the health check because there are some drawbacks of BMI and how BMI is calculated. There's the classic things such as if you're somebody who does high intensity workouts, you're a rugby player, got a high muscle mass, you will come up with a high BMI. So body fat actually addresses some of that inaccuracy. Ellie's now moving on to a risk assessment around alcohol. She's been asked a number of different questions around how much she's drinking, how much she drinks per day, how often she drinks per week or per month. And that will also give Ellie an assessment around the level of risk around her alcohol intake. The next part of the health check is an activity assessment. So Ellie's been asked a number of different questions around how much exercise she does, how often she goes to gym, and whether she is doing enough of exercise. And again, through answering these questions, she'll be given a risk score and therefore receive some advice about what she should do, whether she needs to take up a little bit more exercise. So that's the health check finished. At the end of the health check, all the results are sent to the app or web portal that SISU provide. That's free to users. You can access all of your results. If you do multiple checks, you can see the trends. And there's some behaviour change programs in there as well to help with things like looking at exercise, weight management, as a diet planner, and a bit of gamification. So you can play around to say, if you quit smoking, how would that affect your heart age, as an example.